Good morning, and welcome to this month's NJSAP wrap-up. We're going to be talking about the programs with the ARC of New Jersey. Every month, I highlight NJSAP, so I won't be talking much about our program. Instead, I wanted to highlight the amazing work that the other programs with the ARC of New Jersey have done. To start, we have our Family Institute, directed by Jennifer Harrison. For more than 60 years, the ARC of New Jersey has been committed to providing information and advocacy to children and adults with intellectual and developmental disabilities and their families. Ensuring that families have the tools they need and are empowered to act have been their top priorities. The ARC of New Jersey Family Institute is dedicated to providing timely information, advocacy, support, and training to family members of an individual with IDD. It consolidates all of their outreach and support to families under one program and greatly expands upon the activities that the ARC is currently providing to families. It is crafted with the knowledge and expertise of their past initiatives in mind and strives to harness the growing enthusiasm of families currently engaged with the ARC. So let's talk about children's advocacy next. Children's advocacy at the ARC of New Jersey connects children with IDD to the appropriate state services that will help them develop and achieve long-term goals. The program works directly with children and families to provide individual and systems advocacy related to early intervention, the children's system of care and perform care, and special education and related services. Upholding the ARC's reputation as the go-to place for people with IDD and their families, children's advocacy acts as a resource to provide this population with quality information and support that is unmatched. In addition to providing one-to-one support, the program also develops innovative and dynamic content to make information more accessible to a broader audience. The program's director, Adara Heilman, remains active with families of the ARC and statewide parent groups, shaping the program's advocacy efforts to directly reflect issues faced by children with IDD and their families. By maintaining relationships with state agencies and members of the New Jersey legislature, the program is able to effect policy change to improve service systems and secure needed funding for children with IDD. Next is CJAP, or the Criminal Justice Advocacy Program, which is directed by Robin Holt. The Criminal Justice Advocacy Program serves as a clearinghouse for information about offenders, victims, and witnesses with developmental disabilities, and serves as a liaison between the criminal justice and human service systems, monitoring the quality of care and service provided to those with developmental disabilities as they move from one system to another. There are at least 25,000 people with intellectual and developmental disabilities in the nation's prisons, and some studies indicate that the actual number may actually be twice that. This means that approximately 1 out of every 20 prisoners in the United States has a developmental disability. Offenders with a developmental disability face certain disadvantages at various stages while involved with the criminal justice system. CJAP provides alternatives to incarceration on behalf of individuals with developmental disabilities who are defendants in the criminal justice system and is the only program of its kind in New Jersey. Now, please be advised that the Criminal Justice Advocacy Program does not provide legal advice or services. Next, Connor Griffin directs the Healthcare Advocacy Program. The ARC of New Jersey's Healthcare Advocacy Program promotes quality healthcare for people with intellectual and developmental disabilities throughout New Jersey. If you need help navigating the system or help with Medicaid, Medicare, Social Security, or another healthcare-related topic, this program can help. Connor also offers virtual office hours on Mondays from 1 p.m. to 3 p.m. You can meet with Connor Griffin, the Director of Healthcare Advocacy, regarding healthcare questions and other concerns. Appointment slots are available on a first-come, first-served basis, and time may be limited as needed to accommodate all registrants. So now let's talk competitive employment for people with IDD. Colleen Kollick directs our next program, Project Hire. Project Hire's missions are to promote the abilities of individuals through full-time and part-time integrated employment in the community, to develop and sustain a natural on-the-job support network for the employee, to help the employee in reaching their fullest potential and aspirations through career counseling, to assist employers in diversifying their workforce while hiring qualified individuals to do the job, and to assist the employer in reducing their cost of hiring and retaining employees. The ARC of New Jersey's Project Hire is a supported employment program designed to connect people with disabilities to integrated employment opportunities in their community. The program assists adults with disabilities in finding and maintaining competitive integrated employment. The program also assists middle and high school students in their preparation and transition to adult life with its School to Work program. Project Hire is accredited for Community Employment Services and School Transition Services by the Commission for the Accreditation of Rehabilitation Facilities, or CARF. Project Hire is also a Medicaid-approved service provider. Another program offered by the ARC of New Jersey is Training and Consultation Services, directed by Samantha Goldfarb. Training and Consultation Services is a DDD-funded program that specializes in developing high-quality assistance and education related to employment supports. Their customizable trainings help providers develop the skills they need to perform at high standards and teach advocates how to benefit best from this service. Attendees can pick from their current training catalog or request a new training specific to their needs. TCS is also available to consult on any questions or concerns related to supported employment in New Jersey. Their services have no limits to the number of uses and are completely free of charge to those receiving or providing DDD employment services, so please reach out if they can assist you in any way. Samantha also hosts office hours Wednesdays from 2 p.m. to 4 p.m. and Thursdays from 9 a.m. to 11 a.m. And last but not least, we have our Planning for Adult Life program directed by Rebecca Nash. Planning for Adult Life is a statewide project funded by the NJ Division of Developmental Disabilities, or DDD, to assist young adults between the ages of 16 and 21 with developmental disabilities and their families in charting a life course for adulthood. They offer a variety of resources, including informational sessions, webinars, and resource guides or materials that address the following core areas: post-secondary education and employment, housing, legal or financial planning, entitlement programs and eligibility, self-direction, health or behavioral health, building and maintaining community ties and friendships, and planning or visioning a life course. Children's Advocacy and Planning for Adult Life also have youth advisory board meetings to help the earliest generations learn about advocacy and independence. So each program has extensive information on the ARC of New Jersey website, so please check them out. Anna Panday did a more in-depth webinar covering the programs more intensively. You can watch that on our YouTube if you would like to learn more. And I wanted to thank you for watching our NJSAP wrap-up. We hope to see you in the future. If you have any questions or if you would like more information, please email me at esmithers@arcnj.org. That's ESMITHERS@arcnj.org. And until next time, that's a wrap.